Hi everyone, I'm Dr. Ava Collins, urologist and senior health specialist. And welcome to your space for better health and stronger living. If you want to feel more energetic, confident, and healthy every single day, you're in the right place. Let's get started. And today, I want to have one of the most important and potentially life-saving conversations you may ever hear about your health after 70. Because there are certain medical tests that doctors routinely order for seniors, believing they're precautionary. But in reality, they may cause more harm than good. You deserve to know the truth. You have the right to question these tests and to make informed decisions about your own health. For 25 years in geriatric urology, I've watched hundreds of older adults suffer complications, fear, and loss of quality of life, not because of disease, but because of unnecessary testing and that's exactly why I made this video. Because when you understand which tests truly help and which ones may lead to anxiety, false diagnoses, and even dangerous procedures, you gain something priceless: control over your health, peace of mind, and the freedom to live fully in your later years. So, welcome back to this space where patient advocacy outweighs medical routine and where informed decisions replace blind compliance. Whether you're over 70 yourself or caring for an elderly loved one, please stay until the end, because the information I'm about to share could protect you from unnecessary harm and even extend your healthy years. Here's what I've observed over 25 years of practice. There are 5 medical tests routinely ordered for seniors over 70 that can cause more damage than benefit. Yet over 90% of doctors fail to have an honest risk versus benefit discussion before recommending them. It's time to change that, because what saves lives at 50 can destroy health at 75. Older adults require a completely different approach, one that's based not just on age, but on overall health, life expectancy, and what truly matters most: quality of life. Now, let's go through the 5 most commonly over-ordered tests and why you should think twice before agreeing to them. Medical test to question number 1, PSA screening for prostate cancer after age 70. This is one of the most overused and misleading tests in elderly men. The U.S. Preventive Services Task Force explicitly recommends against PSA screening after 70 because the harms far outweigh the benefits. Why? Because prostate cancer in elderly men is usually slow, but PSA tests lead to biopsies that can cause infections, bleeding, and pain, followed by unnecessary treatments like surgery or radiation that can result in incontinence and erectile dysfunction for the rest of a man's life. A massive JAMA study of over 76,000 men found 0 survival benefit from PSA screening after 70, but significant harm through overdiagnosis and Before agreeing, ask your doctor. Given my age and health, what's my realistic life expectancy? Would I die with this cancer rather than from it? What are the risks of the biopsy or treatment you're recommending? Medical test to question 2, routine colonoscopy after 75. Colonoscopy is vital for colon cancer screening in younger adults, but in seniors especially those with prior normal results, the risks often outweigh the benefits. Elderly patients face a 3 to 4 times higher risk of colon perforation, bleeding, and anesthesia complications. The American College of Physicians advises against colonoscopy in adults over 75 with average risk and prior negative results. At this age, the chance of developing a life-threatening colon cancer is minimal, while the procedure's dangers are real and immediate. Ask your doctor. Given my past screenings, what's my actual risk now? What are the specific complication rates for someone my age? Are there safer, non-invasive alternatives, like stool tests? Medical test to question 3, routine mammography after 75. Just like prostate screening, mammograms in elderly women often detect slow-growing cancers that would never affect lifespan. Research in JAMA Internal Medicine found that mammography after 75 increases detection, but not survival. In fact, it often leads to unnecessary surgeries, radiation, and chemotherapy, all of which can reduce quality of life and cause severe complications. Ask your doctor. Would treating a slow-growing cancer actually help me live longer? What does evidence show for women my age? How can I maintain quality of life rather than chase aggressive treatments? Medical test to question number 4, aggressive diabetes screening and tight glucose targets in frail seniors. Tight blood sugar control can be deadly. Doctors often aim for an HbA1c below 7.0, but research shows this can cause dangerous hypoglycemia, confusion, falls, and even death. The American Diabetes Association now recommends relaxed glucose targets. HbA1c between 7.5 and 8.5 for older adults with limited life expectancy. So if your doctor is pushing intense glucose control, ask, what glucose range is safe for me personally? Am I at risk for hypoglycemia? Would a more moderate target actually help me live longer and safer? Medical test to question 5. Routine full body scans and imaging for cancer. This one is particularly harmful and frighteningly common. Doctors often order CT scans, PET scans, or MR is just to check. But these expose patients to radiation and often detect harmless incidental findings, spots, nodules, or minor abnormalities that would never cause problems. Once these are found, they trigger cascades of biopsies, surgeries, and anxiety, leading to real physical harm. A JAMA study found that 23% of elderly patients with incidental findings experienced complications from follow-up procedures with zero improvement in survival. Before agreeing to imaging, ask, what exact symptom makes this scan necessary? Would any finding actually change my treatment or life expectancy? What's the risk of discovering something that leads to unnecessary harm? Let me tell you about a 78-year-old patient who came to me after his doctor ordered a routine PSA test. His result was slightly high, leading to a biopsy which caused a severe infection and hospitalization. The biopsy found a slow-growing cancer. His urologist urged immediate surgery. But when I assessed him, his life expectancy was roughly 8 to 10 years, and the cancer would take 15 to 20 years to cause problems. He chose active surveillance, simply monitoring. Today, he's 83. He's healthy. The cancer hasn't grown. Had he gone through surgery, he'd be living with incontinence and pain for no survival benefit. And sadly, this story isn't rare. I've seen hundreds of similar cases. The medical evidence is clear. Most organizations now recommend against routine cancer screenings in adults over 75 with limited life expectancy. Testing must be individualized, not based purely on age, but on total health and personal goals. The question isn't can we find disease? It's would finding it actually improve or extend my life? And most importantly, you have the right to refuse any test that doesn't align with your values or health priorities. My 3 golden questions before any test after 70. What's my realistic life expectancy based on my overall health? If it's under 10 years, most cancer screenings aren't recommended. If this test finds something, what would the treatment involve and what are the risks? What does evidence say about this test for people my age and health status? Always demand evidence, not routine. You are not a protocol. You are a person. Avoiding harmful tests doesn't mean ignoring your health. In fact, there are gentle, natural ways to support vitality, energy, and circulation, helping you stay strong enough to reduce medical interventions altogether. For seniors seeking safe, natural support, I recommend organic watermelon extract, rich in L-citrulline. For heart and circulation support, advanced senior vitality formula, combining Icarin, Tongkat Ali, fenugreek, nettle root, and L-citrulline for balanced hormones, energy, prostate health, and cardiovascular strength. Together, these support your body's natural resilience, so you stay active, confident, and less dependent on aggressive medical care. Links are in the pinned comment and video description below. Your health after 70 shouldn't be about fear. It should be about freedom. Freedom to ask questions, freedom to choose wisely, and freedom to live your remaining years with dignity, energy, and peace of mind. Remember, knowledge is the most powerful medicine. So stay informed, stay curious, and always, always make decisions that serve your quality of life, not just medical routine.